Support for Carolina Business Review made possible by Sunoco, a global manufacturer of consumer and industrial packaging products and provider of packaging services, with more than 300 operations in 35 countries, headquartered in Hartsville since 1899. And by Business North Carolina Magazine. There's a place for those who subscribe to the theory that business doesn't have to be boring.
Well, with Memorial Day, the official kickoff to the Carolina summer season of travel and fun, it always strikes an optimistic tone. And given this spring's epic and killer wave of weather, we could certainly use a change and some good news. Welcome again to the most widely watched source for Carolina's business and public policy. I'm Chris William, and this time on CBR, what are the issues as we head into the hotter, slower summer? And how do we see our way clear through the political morass and unclear business climate? Later on, Ron Paulus from Western North Carolina's largest hospital.
Major funding for Carolina Business Review provided by Grant Thornton, an international accounting, tax, and business advisory organization dedicated to serving middle-market companies. Grant Thornton, a passion for the business of accounting. And by Novant Health, a not-for-profit group of hospitals and physician clinics, ranked as one of our nation's 10 best healthcare systems, caring for patients and communities in North and South Carolina. Major funding also by King & Spalding, an international law firm with over 800 lawyers in 13 offices worldwide, providing legal services to clients in the Carolinas and throughout the world. For more information, visit www.kslaw.com. This edition of Carolina Business Review was recorded May 27, 2011. On this week's program, Jane Patterson of ENC, Tom Vogt of the University of South Carolina, and special guest Dr. Ron Paulus, CEO of Mission Health System. Now, Chris William.
Hi, welcome to our program. Sorry, we were having a little pre-party conversation. Tom, Jane, good to have you both here. And
thank you.
Pleasure. And thank you. Let's start with a fairly broad issue. Here we are getting into the summer in the Carolinas, and it seems like things are getting better. It seems like business is getting better. Tom, you're with USC, University of South Carolina, and the Nano Tech Center, and you could make the argument that your business is education and healthcare. And Jane, you are an agency of the North Carolina government, and here you both are in very critical industries, but also facing probably more critical cuts. Kind of give us a sense of how you see this economy, and as you hear the debate in the State House, not far from your campus, Tom, in Columbia, and Jane, not far from your office in Raleigh in the General Assembly. What do you fear the most, or what are you most encouraged about? Tom, we'll start with you.
Well, I'll start with the things that I'm very encouraged about. This time that we're living through basically pushes us to do more with less, and I think we're achieving that. If you look at our mission, which is education and research, we're educating more people at the University of South Carolina and more South Carolinians at the University of South Carolina than ever. Our federal research grants are up. We are engaging in early economic development and tech transfer. Innovista is growing. The buildings are getting filled. New faculties are being hired. So overall, I'm actually very, very optimistic. Now, what is happening underneath there is that our business model and our institutional culture is changing. But higher education is not unique with respect to that. That's also happening in other areas, in particular healthcare.
Does this ring true with you? Any of this ring true with you, Jane?
Yes, I used to be a vice chancellor of a university, so I'm well aware how universities have to do more with less and have more students that are actually, in North Carolina, we're very fortunate that we have 37 private colleges and universities along with our 16 public institutions. And so we have, though, a lot more students in this state to educate because of how large this state is becoming as the 10th largest state. One of the issues for us, at least, is how do we get the resources that rural communities need in North Carolina. We have the second largest rural population in the country next to Texas. And with the latest census, we are actually only 150,000 people less than the rural population in Texas.
So let me understand something here. So is progressive as North Carolina would like to think we are, or in fact that North Carolina is, it has the largest population next to Texas, a larger rural population. How does it compare? How does South Carolina fall into that?
But it's very far below us. The next closest to us is Pennsylvania, and they have 2.5 million rural citizens. We're 1 million more practically than they are.
Okay, so let me bring it back to this. You are a state agency, and there, not specifically about North Carolina or ENC, there is a sunset provision at the end of this year. What happens, whatever happens to the provision, when, as a state agency, are you concerned that that broadband, that access for those who don't live in urban areas will go away or be severely handicapped because of what is going on now with budget battles?
I think that's a strong possibility. I think the concern I have is, in North Carolina, we have been extremely involved in everyone working together. The private sector companies, the nonprofit companies, the communities, et cetera. And without an ENC authority, you lose a lot of that collaborative glue that holds everyone together. And you end up with people arguing with each other and with lawsuits that take place. We don't want to see that in North Carolina. We want to see our state still move ahead. We are now at about 80% of the state's households that can, in fact, get high-speed broadband if they want to buy it, okay? But there's 20% of the people that don't have it. Well, we would not have said many years ago, 20% of you aren't going to get electricity. We're just going to leave you out there with the candles.
Yeah, and Tom, let me bring you into this, because you are clearly on the cutting edge of a lot of technology at the Nanotech Center. And when you hear Jane talk about having all residents of any state or any community, rural or otherwise, having access like that, how critical is that to a technology like nanotech, or to just economic development around technologies like nanotech?
I think it's part of it is nanotechnology will play a role, and the bandwidth is growing. We are now looking at 4G, and who knows when we'll be at 10G, so the bandwidth will grow, and that's very important. It's important from a healthcare point of view, but at universities, due to the change of the business model, one of the areas that's expanding is distance learning, and distance learning requires very good bandwidth too, so that more people can have access to education, more people in rural areas can have access in education, because we have to definitely increase the diversity of our freshman class.
Okay, we've got about 30 seconds left, so not to interrupt you, Tom, but you know, distance learning is, we've talked about distance learning for 20 years now. Is this something that it just doesn't sound good in the halls of Raleigh or Columbia, but distance learning really is critical to going forward?
It's absolutely critical. This year, 55,000 high school students were in our virtual school in North Carolina. We're second to Florida in the number of virtual students that we have. And the second thing that's critical, for the first time ever, we have more students taking classes virtually at community colleges than we have taken, than actually are going to community colleges. And the third thing is, we rank about first or second in the country in the number of actual courses that we have online and your ability to get degrees online from our university system. So you're going to have to serve more people with less money. You can't do it by building buildings.
Yeah, why would I think that you wouldn't have a good response to that question? I don't know why I even floated that out there. Thank you. Our guest is coming on in just a second. Next week on this program, there is you could call it a phenom. There is a company called Red Ventures, very hot marketing company, but what does that really mean? There are thousands of those out there. Next week on this program is the CEO of Red Ventures that is based in upstate South Carolina, Rick Elias, will be here. And then in 2 weeks, the Democratic National Convention glow is still very much alive in Charlotte and the Piedmont, and one of the point men involved in that effort, Mayor Anthony Fox from Charlotte, will be on this program in 2 weeks. You know, not that long ago, hospitals used to be thought of as a fairly bulletproof institution when it came to the economy. The toughest part for hospitals was managing their growth. Good problem to have. Well, now between Obamacare and the Great Recession, it takes deft, finesse, and real industry insight to flourish and grow. Joining us now is the Chief Executive Officer of Asheville-based Mission Healthcare Systems, Dr. Ron Paulus. Dr. Paulus, welcome to the program.
Thank you.
Gosh, where to start with healthcare and the new economy, Ron? Well, let's start with Mission. largest hospital system in Western North Carolina. Ron, let's go back to 1995 and the merger between Mission and St. Joseph's at the time, and the very unique arrangement that had to be struck with the state of North Carolina in the form of a COPA, or tell us what that is.
Certificate of Public Advantage.
And that was due to many felt like there was an unfair advantage that the combined institution had some 80% of the market share. So you've been operating for about 16 years under what many hospitals don't have to. Is this COPA been, in your opinion now, looking back on it, and fairly new into the job, has this been a handicap that kept Mission from really flourishing?
I wouldn't say that. I think it's been a tremendous service to the public, thus the name Certificate of Public Advantage. When that arrangement was made with the state, the idea was to take out substantial amounts of cost from the health system, to put a cap on what its operating margin could be so that it wasn't able to price things too high, and to put some restrictions that back 16 years ago made a lot of sense around employment of physicians, particularly primary care. But I think the landscape has shifted so dramatically, as you note, that while it's been successful, it's time for a little bit of a change.
So Representative Davis from Macon County in North Carolina has proposed making that even more restrictive. He's not on this program, so we don't really have a chance to talk about the other side, but I do want to ask you, if his proposal is not just a proposal but a bill he is floating, if this goes through, will it make it more difficult for Mission to be competitive in the marketplace?
Absolutely. That's the design of the bill, is to make it so that Mission can't be competitive in the way that other health systems have been. We face a significant amount of competition that's also shifted dramatically from that time ago when the merger happened. Carolina's healthcare system is actively engaged in the region. They're a terrific system, very well run, an important competitor. The Adventist Health System, one of the largest health systems in the country, based out of Florida, has a hospital in the region. And the whole dynamic has shifted. If those restrictions were to be actually put into law, which we don't believe that they will, it would be essentially impossible to operate as a normal healthcare system would.
Mm-hmm. Tom?
We've just talked before that the challenges of higher education and I think healthcare too is to do more with less. And we just finished on a note talking about distance learning. I know that you're doing fantastic things with respect to telemedicine, teleradiology, and telestroke technologies and
telepsychiatry. Yeah.
Right.
I'd like to ask you to expand a little bit on that, and how do you see this developing, and how much do you think will this benefit with respect to the overall discussion on reducing healthcare costs?
Well, I think, as somebody said earlier, doing more with less is the watchword of the day. That's what we all have to do, and in a way, that's what Mission's been doing for some time. We have one of the most disadvantaged payer mixes in the entire state. Over 72% of our patients are Medicare or Medicaid. So lowering our costs, which was part of the COPA, is effectively what we have to do on a daily basis. We have been investing significantly in telemedicine. We had our first couple of telepsychiatry consults between outlying facilities just in the past couple of weeks. We have a mental health problem throughout the state, particularly in Western North Carolina. We're looking at telestroke today. We've reached out to all of the hospitals in Western North Carolina to try to make them part of that network, because to duplicate all of these services in each and every place is not cost effective, and yet patients need to have care accessible locally that's state of the art.
Don't you think there's also a need for a hospital like Mission St. Joe to also work directly with a lot of the private providers, the doctors that are out there, and to also work with the schools, like the new school health clinic up at Mitchell Library?
Absolutely. Without our physicians, our private practicing physicians, our employed physicians, all of them, the hospital is just a building, and with some terrific nurses and other clinicians, but we can't do what we need to do. And when you think about some of the biggest problems that we face that drive many of the costs, whether it's diet, lifestyle, other kinds of factors, getting into the schools and accessing children from a very early age is absolutely essential. And we have a relationship with the new school. Was at a dinner for the Medical Minority Mentoring Program last night. Getting to our kids is what it's all about.
You know, let me follow up on something here. Ron, arguably, you're a new sheriff. There's a new sheriff in town, you know.
Or at least a deputy.
And there's and you're selling yourself, and you're selling Mission St. Joseph's on Mission Healthcare, Mission St. Joe's. I still call it that.
I call it Mission St. Joe. I'm
still
sorry.
think they're two separate hospitals.
Yeah.
But you still sell Mission on its credibility. You know, there was a rub with the old CEO and some of the physicians and some of the folks around that. And now to layer on top of that, you've got this COPA, and you've got some of physicians in the region in Western North Carolina saying, these guys are still a 900-pound gorilla. We still can't compete with them. We still don't think it's fair. So I guess the point is how do you sell your credibility and trying to be as authentic as you can that you are trying to do the right thing in Western North Carolina?
It's a fair question, and I think folks are aware of some of the controversy that occurred prior to my arrival. You know, I may be too naive and simplistic, but to me it's all about focusing on the patient. And when people talk about, we don't want you doing this, or you shouldn't come into this county because of this, to me that's not the question. The question is, what do the patients need? Our mission statement is to serve and improve the health status of all citizens of Western North Carolina. Because we're the only tertiary quaternary provider in that region, we offer some of the only services for those citizens. So we're part of that entire region by definition. And I think if we can be transparent and open, patient-focused, the test that I always ask is, what would you want for your own mother? And if we can answer that question to the satisfaction of the residents and the community and our peers, I think we'll be just fine.
And I think I would add that besides the bandwidth that you need to really reach out across the mountains, you need a lot.
Yes, we do.
So do the homeowners, the people who have the homes, the patients who are at home that you'll be able to reach out to and actually monitor remotely. We need the companies to keep building more and more bandwidth out in our western part of the state and all across the state.
We do. Where I came from in Pennsylvania, which was also fairly rural in the middle of the state, we had over 2,000 patients with devices in their home that were constantly streaming data back and forth. Right. Now, Kaiser Permanente in California, they've eliminated 24% of their entire ambulatory visits by telephonic and e-visits. We don't need to incur the cost or the inconvenience of folks traveling from one place to the next, but they need to have state-of-the-art services. Broadband is an essential part of that.
And I think people don't realize when they look at the ecosystem around the patient, that when the patient has to leave work, someone has to go with them to drive to the hospital, that the costs usually are not actually calculated in to the total cost of health care.
Tom?
There's a lot one can do with broadband and with better communication and telemedicine, but there's also the question of workforce development, and in particular the supply of primary care physicians. And in South Carolina, we've just had extended discussions since the Greenville Hospital System and the University of South Carolina are starting another medical university, or part of the medical university expansion of Greenville campus there. Where do you see the need for primary care physician going, and what type of primary care physician? Somebody closer to the patient or somebody closer to the, let's call it, technology?
Very important question, very insightful point. It's undeniable that the number of primary care physicians and other primary care providers, the need is greater than the supply. If we look at Western North Carolina compared to North Carolina compared to the nation as a whole, we're underserved in every county, essentially but Buncombe County, because of the amalgamation of physicians in that location. This is one of the points I've been trying to make as I've traveled around the region, that we need to increase the supply of providers so that more care is delivered at a more effective point in time. we die at a faster rate from all of the common diseases in Western North Carolina: heart disease, cancer, COPD, Alzheimer's, et cetera, and yet sometimes people get so fixated on what they have today and, you know, the food on the table, they don't think about the unmet need and the opportunity to grow things so that everyone can benefit. I think care should be delivered as close to home as possible so long as it's safe and effective, and that requires some amount of hands-on, touching, interacting directly, but can be augmented by some of these virtual technologies from remote locations.
And I think the research does show that when a patient who is remote from the hospital and their doctor are on with the tertiary physicians at the hospital, the patient feels like they have much better health care. And in fact, the doctors like it very much because they get continuing education while they're right there with their patient.
I agree. I think we've only begun to scratch the surface of the opportunities in terms of remote and virtual presence. And with an area as geographically spread and diverse as what we have in Western North Carolina, it's just essential. It's hard to attract and retain those providers, and that's another advantage that a larger system can provide some of that stickiness and help without having to go in and, you know, own and control everything in the area, which is, you know, the fear that folks express.
What do you and your senior leadership team talk about when it comes to strategy? You had cited that almost 3/4 of the patients that you treat are Medicaid or Medicare.
Right.
That has got to be a concern with not just the budget that's going on in Raleigh for you in North Carolina, but also the federal budget and the flow-through dollars. So how do you strategize? What do you talk about in board meetings, at least the stuff that you can tell us about? But how do you strategize? What is the sensitivity analysis that you do based on X if X or Y happens?
Now, that's a big question. I'll give you the best answer I can in a reasonable period of time. Number one, I'm a glass half full kind of guy, you know, so I look at our precarious payer mix as an advantage in the sense that we've learned to survive with a lower cost structure than what most health systems around the country have. There are very few systems that could actually, you know, generate a return to reinvest in programs, people, and equipment with that kind of payer mix. It's totally aberrant compared to the rest of the state and the rest of the nation. And we've learned to sort of survive with less oxygen. I think that's a good thing because over time, I think every health system in America is going to have to get to the point where they can break even on Medicare. If you can't do that 5, 7, 8, 9 years from now, you're not going to be around. So we're a fairly long way down that road. We have the 3rd lowest prices in the state, and our quality parameters have fared well both locally, regionally, statewide, and nationally. And in fact, we had the Medicare division from the federal government who asked us whether they could come visit because what they said was if every hospital in America achieved the clinical outcome performance that Mission does at the cost you do, we wouldn't have the problem nationally that we have. So it's a challenge. It can't get too much worse or we're going to run into real difficulty. But it's all about getting the patient to the best outcome.
Do you? And I know you can't answer this in a short period of time, Ron. But what is your gut? What does your gut tell you will happen with these Medicare dollars, Medicaid dollars, and Medicare dollars?
I think the dollars are going down, and I think that more responsibility will be assumed by clinical entities, whether those are hospitals or so-called accountable care organizations, large physician practices. We have a perverse payment system today where the more you do, the more you get paid. It doesn't matter in most cases what your outcomes are, and that's just not realistic. It's not true for any other industry segment in America. You have to be able to perform, you have to be able to compete, you have to be able to meet the patient's or the consumer's expectations, and the world's getting tougher. It needs more infrastructure. That's why we have one overarching strategy, which we call our bigger aim. It's getting every single patient to the desired outcome, first and foremost without harm, that's basic. Second, without waste, and that's where the efficiency component comes in, driving productivity, driving supply costs down, and so forth. And third, with an exceptional experience. And that's the way that we should be competitive with one another around achieving that outcome for each individual.
We have about 30 seconds left.
Well, I think that what you've heard here is education, workforce, medicine, and also broadband really do fit together. And communications technologies knit these very close together. And I think in the future that, we need to really make sure that the broadband is out there so that he can do the telehealth, and so that the workforce investment can be done via the air if necessary, where the outcomes are just as good.
As well as the patient education.
Yeah.
Well, I don't think there's any disagreement here. Ron, thanks for being on the program.
Thanks
and
so much.
We'll be watching closely as you press on there. And I know at least the docs in the system at Mission St. Joe's or Mission Healthcare have a collective sigh of relief now that a doctor is running the joint, so to speak. But good to have you here. Thank you for being on the program. Jane, good luck at North Carolina, ENC. What do you guys say? Do you say ENC or
We
North
say
Carolina?
ENC. Yeah.
Okay.
It's a lot. You have a lot more time to say other things if you leave off the North Carolina
sure.
Authority.
Thank you for being on the program.
Thanks
Always
very
nice
much.
to see you. Tom, welcome from USC, and good to have you. It's not too hot in Columbia yet, is it?
No, it's never really hot.
Yeah, and I saw, by the way, I saw the new thing about the a great hot place, but surprisingly cool, the new Columbia tag. Thanks for being on the program. Until next week, I'm Chris Woody, and we certainly hope your weekend is good and that your week is good. Thank you. Good night.
Major funding for Carolina Business Review provided by Grant Thornton, an international accounting, tax, and business advisory organization dedicated to serving middle market companies. Grant Thornton, a passion for the business of accounting. And by Novant Health, a not-for-profit group of hospitals and physician clinics, ranked as one of our nation's 10 best healthcare systems, caring for patients and communities in North and South Carolina. Major funding also by King & Spalding, an international law firm with over 800 lawyers in 13 offices worldwide, providing legal services to clients in the Carolinas and throughout the world. For more information, visit www.kslaw.com. Additional funding provided by Business North Carolina Magazine. There's a place for those who subscribe to the theory that business doesn't have to be boring. And by Sunoco, a global manufacturer of consumer and industrial packaging products and provider of packaging services, with more than 300 operations in 35 countries, headquartered in Hartsville since 1899. And by viewers like you. Thank you. You may write us at Carolina Business Review, 3242 Commonwealth Avenue, Charlotte, North Carolina, 28205.